Does that make sense?
Yeah, I want to show you something.
Okay.
Now here's this is one of the reasons I called you. Do you see this on the screen?
Hey, I really. Okay. Yeah. Yeah, I could see that. Yes.
Yeah. Okay.
And the magnifier. Yes.
This is the list of pathologies by type.
Yeah.
And I want you to test down this list. Okay? So I want to see what pathologies you get a signal on. And I'm going to say the names of the pathologies. Instead, you don't have to use the magnifying glass. I'm going to help you. Let's start with, see if you get a signal on, we're going to see which ones to remove, okay? Bacteria. See if you get a signal. And I'm just going to move on from after.
I don't feel a signal. No.
Okay, I'll move on after each one. Fungus.
There may be something there. Yes.
Okay, so we're going to make a mental note of fungus. Chiropractic problems, you know, that sort of thing that would be handled by a chiropractor. Anything there?
No.
Okay, rot.
What was that? Rot?
Rot. Anything
No.
there? Okay, opportunistic infection.
There may be something there. Yes.
Okay, virus.
No.
Parasite.
No.
Okay, now that was one category, and you found two things. You found fungus and opportunistic infection, am I right?
That's correct.
Okay, let's start with opportunistic infection. And what we're going to do now, let me show you something else. There's a list of bodies. Have you ever seen these lists before? This is the list of 12 bodies by testing hierarchy right here. See, that's the title of it.
Oh, I see that.
Yeah. Now, have you ever seen these lists before? Have you ever used them?
No, but I mean, some of the term I'm familiar with.
Okay. So, okay. We're going to start with, do I have opportunistic infection in my celestial body?
You want me to test for that?
Yeah, that's the question you want to ask. Do I have opportunistic infection in my celestial body? Because you found a little, let's see where it is now. We're going to find where it lives.
Okay.
Get it out.
No, I don't feel it.
Okay, gravitational body.
I feel something there.
Okay, so you now say, I am now removing all opportunistic infection from my gravitational body.
I now remove all opportunistic infections from my gravitational body. And now remove opportunistic infections from my gravitational body.
Until when you get a signal, it means that you've done that.
I feel something, yes.
Okay, good. And that's what it is to actually remove this thing. Now, either of these could be a cause of and/or a contributing factor in loss of eyesight.
Mm-hmm.
Either of these infections.
Mm-hmm.
Okay, so the next thing is, let's try doing something with fungus. Do I have any fungus in my celestial body?
Do I have any fungus in my celestial body? Do I have any fungus in my celestial body? I don't feel anything.
Okay, gravitational.
Do I have any fungus in my gravitational body? Do I have any fungus in my gravitational body? No, I don't say.
Okay, so try the spiral body then. See, here's the
Do I have any
list right
fungus
here.
in my spiral body? Do I have any fungus in my spiral body? I'll slide something there.
Okay. Now, by the way, when you do this, you know the stillness you were talking about that you go into when you meditate?
Yes.
Well, it will help you test if you go into that stillness while you're
Yes.
testing. So
That's what I'm doing, yeah.
Yeah, okay, good. I just want everybody to know that because a lot of people need to, everybody who watches this needs to know that you want to be as still as possible. So now remove it like you did the other one. And when you get your finger signal, you've removed it.
Okay, what was now? The statement is I now remove.
Removing fungus. I'm now removing all fungus from my
spiral body.
Yeah.
I'm now removing fungus from my spiral body. And now removing from my spiral body. Okay.
You got a signal. Now,
yes.
Can you feel your spiral body?
I gotta be honest with you, I'm not sure what my spiral body is.
Well, it's another body that's near your body, or maybe not so near it, but you can access anything anywhere. Did you know you can actually do a chiropractic adjustment on another person without touching them? Did you know that?
I believe that.
Well,
I believe that.
Well, it doesn't matter how far away they are. They could be on the other. They could be in Thailand, and you could be on the phone, and you could adjust them. You can do this. Anyone watching this movie can do this.
Yeah, that I believe. I mean, that has to do with quantum physics.
Right.
Yes.
So
I'm very familiar.
Okay, so that means you can read if your gravitational body is in Thailand or your spiral body is in Thailand, you can read it. And so I want you, when we get off the phone, I want you to practice what I'm showing you. You're supposed to be doing this and have no pathologies anywhere. What you need to do is keep yourself free of pathologies at all times.
Okay.
Now, the pathologies, I'm going to show you where they are, the list, these two lists. You can put your hand down, and this is going to be your homework from this session. So I'm going to get, this is your homework, and we'll see how you do later. I'm going to show you where they are. Okay, I'm going to make this small. You don't have to try to read this, because I know you can see it. Anyway, this is the hub. It's called the Cure Hub, and there are these columns on it. And over on the right-hand side, and I'm going to just zoom in on this, there's an area that says Print Out, and the pathologies list and the bodies list are the first two things on that list. Whoopsie, you can't, wait a minute. Hang on. You can see them now, I'm sure, because I made them really big for you. But
yeah.
Anyway, okay, so this is your homework: is keep staying free of pathologies. Yeah, you think you can manage to, do this throughout the day and keep yourself as free of them as possible? It'll be, just working at first, and do you feel any different than when you started doing this?
You mean from this session?
Yeah. Do you feel any different?
No, I'm calm. I feel calm.
Yeah. Okay. Well,
very calm.
You'll probably, this is probably what it's going to be like. You'll probably have to do this a long time, during the day to notice a difference. But being calm is good, right?
Being calm is very good.
Yeah. So.